in terms of death rates that has made it has not made an improvement, but really declined a pretty substantial amount of suicide. As you can see, there's almost a 400% increase in suicide rates for 5 to 14-year-olds in that 40-year time period. The large, overwhelming majority of those suicides are 10 to 13-year-olds. So, just I think in the scope of kind of thinking about what we're going to talk about, this is an area that we really have not made advances in. We're hoping, both in thinking about adding supports and services to families and kind of thinking about this problem differently, because clearly we haven't made any substantial sort of differences or improvements around decreasing suicide, particularly in children, adolescents, and young adults. So we think a little bit about kind of our building blocks and how to sort of establish and build more resilient family systems quite a bit. So we'll talk about some of these during the presentation, but I think first in our foundational building block that we think about is specifically around compassion. And we think about the compassion building block in three different ways. One, we think about sort of helping and building compassion for families for their kids, which probably feels pretty self-evident. As families are going through, a number of, difficulties when they have kids that are really struggling around behavioral health issues, especially with self-injury and suicide, and compassion fatigue happens to families in the same way it can happen to us as providers. So we really need to make sure that we're helping families kind of build and establish and maintain their compassion for their kids. The second way we think about compassion is, for ourselves, compassion for providers to families, and making sure that we're sort of taken care of in a way that we can kind of maintain our compassion for families and for the kids that we're treating. And thirdly, and maybe most importantly, is compassion for families toward themselves. We see a lot of, and understandably, families sort of look toward themselves when things aren't going well. Friends, family, Facebook, Instagram, everything sort of seems to be going well with everyone except them. And it can be really easy for families to lose compassion toward and for themselves. And we really need to help maintain that to kind of keep them in the game. Second building block, assessment, in the same way that we think about assessment to inform a treatment course and clinical care for, individuals, kids, adolescents, adults, we really need to look at families and family systems in the same way. What have families been through? What do they need? What are their, sort of their treatment needs based on their history, and kind of think about assessing a family system in the way that we would assess a child, adolescent, or young adult. Psychoeducation, we'll talk a lot about trauma, PTSD, and Jillian will talk a little bit about that in a moment. But it's really important that we actually talk to that with parents, in addition to teaching really core skills around validation, empathy, and then sort of getting ourselves up to the setting contingencies building block, where we're going to talk a lot about behaviorism and building contingencies, which really, when we help families build effective contingencies, it's really helping them help their kids establish, really good autonomous capabilities, which is, sort of what we want parents to be able to do. Disaster prevention, we really want to make sure that we're leaning into that. Families avoid it at all costs. And, it's unfortunately something when it comes, we want to make sure that, those crisis plans are coming, out of logic when we're not in the moment of a crisis, versus, families sort of trying to figure out what to do in moments of crisis. And finally, ongoing support. What do families need in the same way that we would think about for a child, adolescent, or adult? What does somebody actually need in terms of their care in an ongoing fashion? So, and Jillian will start to talk a little bit about some of the trauma piece.
So Jim and I have worked over the years with many, many, many families, and what we have seen is that, families of kids that self-injure and kids that have engaged in any kind of suicidal behavior essentially are functioning as frontline workers, right? So you are the emergency workers. You are the first on the scene many of the times, and you're up close and personal to risky behaviors that your children are experiencing in. And so, I love this slide because it really, really hits home the impact. So you look at trauma in the general population, and then you start to look at, occupations that you would think would have trauma: social workers, people, oncologists treating cancer, people working with people that use substances, right, who often have very high levels of overdose, people working in violent sexual crimes, military, first responders, those people in the ER, certainly child protection, DCF, DSS workers. And then what the research shows is the top of the scale for people experiencing trauma are parents of children with these types of life-threatening behaviors, right? So self-injury and suicide. And I think this can be surprising. It surprises many parents initially, but when they take a step back and look at what they've experienced and they start to pay attention to these symptoms, it makes a whole lot of sense. So, quick little piece of, here's the psychoeducation building block. One of these pieces of psychoeducation that we provide for parents is that when people experience trauma, right, seeing somebody do dangerous behaviors, something, self-injury, hurting themselves, or making a suicide attempt, or the threat of suicide, right, we have normal stress reactions, right? That's what everybody does. And what we know, and you can see, so everybody's going to have some trauma, right? We often call that an acute stress response. The first month after somebody's experienced trauma, you see a lot of trauma symptoms, right? You see people might be more hypervigilant. They might avoid certain areas related to the trauma, or might not talk about certain things, see certain people, go to certain places. They may have nightmares. They may have what we call flashbacks, or sort of see images of the traumatic event, right? And, typically with social support and with being able to talk and process this and get validation and understanding and within your community, most people don't develop PTSD, right? So they work through that acute stress response, and then they don't end up developing the symptoms for PTSD. The problem with this, group of parents, right, is that this isn't something that often people feel like they can talk about. Okay, this isn't something that people often share with their closest friends in the way that they might share a chronic illness diagnosis of their child, cancer, diabetes, where, we often will say, we've heard from many of the parents that we work with, nobody brings over lasagna, right? Nobody comes and, offers this support, right? We feel like there's a stigma. We often don't have, we can have many, many, many friends, right? But the experience is often one of isolation and lack of social support. That in and itself interrupts the process of being able to get validation and talk about your trauma and how scary this is, which then sort of lets that PTSD and secondary trauma symptoms sink in, right? If family members have their own personal history of trauma, this makes them much more vulnerable to being traumatized and developing PTSD from their child's dangerous behavior, right? And we know that then what happens, right, is that you can see that little kind of arrow on the bottom. You get a PTSD brain, right, that is much more hypervigilant, much more scared. And then often what families will find is that their lives get smaller and smaller and smaller, right? They avoid people, they avoid places, and they live in constant fear of the next dangerous behavior that their child could engage in. So there we go. All right. So yep, perfect. So this is, I think, a very, very, very helpful and often very validating slide for parents to look at. And this is called the secondary trauma checklist. So what happens to the traumatized brain or the traumatized parent, right? And we recognize that you still have to parent through all of these, all of these symptoms, through all of this fear. You have to go to work, and life has to move on. And so people will often say, like, why do I feel this way? Well, this is why you feel this way, right? So parents, that are experiencing trauma will often have feelings of guilt, of anger, right? Which can be very, very hard to talk about. Sadness, feelings of helplessness, feeling disconnected and isolated, right? You can see more depression often in parents that are experiencing experiencing this sort of struggle and journey with their child, right? Many people will say they have a hard time concentrating. It's harder to get things done. They might feel like they're up all night thinking and what we call ruminating, thinking over and over again, sort of what if, what if. Much sort of less interest. We often call it general apathy, but sort of less interested, being engaged, feeling I kind of wake myself up and get what I need to get done, and not feel a whole lot of joy or drive or motivation. And it tends to be more survival coping, like I'm going to do what I do to get through the day. Behaviorally, you may see social withdrawal. Many people have interrupted sleep, appetite shifts. So either we'll have some parents report that they're much more hungry and they've gained weight. Other people will say, like, I just have no appetite, and they'll have a lot of weight loss. There's that hypervigilant, being on alert all of the time, so a very activated nervous system. And you might, feel sort of cynicism, like a more cynicism or sort of like a negative outlook, like things aren't going to work, nothing is going to get better, more of a resignation. Okay, and then there's the physical symptoms that parents will often see, which is, certainly you can have pain. People often get sick more, right? When the body is under stress, the immune response isn't as efficient, so you get more illness. Difficulty taking care of yourself. So, people often say, I used to work out, I don't work out anymore. I used to cook a lot and I felt good eating, home cooked foods. And now I do Uber Eats and DoorDash and, snack because I don't have the energy. And then that just general sense of kind of chronic exhaustion and depletion.
So in an effort to try and kind of combat, sort of the trauma and trying to support parents, there's a number of different, skills that we'll work on teaching parents after this sort of psychoeducation piece, one of which is a concept that was born out of a fantastic study of over 900 families around tenets of mindful parenting. And the tenets, there's nothing particularly earth-shattering that's going to, blow anybody away, parent or us otherwise. Sometimes I think when stress goes up and, certainly when all of that kind of, secondary trauma and hypervigilance escalates, they can certainly slip out of our awareness. So the six tenets, listening, to our kiddos with full attention, having compassion, which we talked about before, for our loved one, non-judgmental acceptance of our parenting mistakes, emotional non-reactivity toward our kids, emotional awareness of our child, and emotional awareness of ourself. And the nice thing with these, I think, these six tenets are that we see kids and families that feel more attuned to one another. We have kids that feel like their parents are more effective in terms of their parenting, and parents that just intrapersonally feel a little bit more confident in their parenting and their connection with their kiddos. One of these six tenets is actually dynamic and powerful enough that when parents practice this tenet on a consistent basis, it actually can lower states of depression and states of anxiety in their kids, which is pretty remarkable. We can certainly feel free to use the chat if you want to take a little game show guess as to whether it's tenet 1, 2, 3, 4, 5, or 6. But the findings, again, were very substantial. And again, just the fact that something that a parent can do can have that much of a significant impact on mood states of their kids is pretty impressive. So for anyone that chose or wrote in tenet 3, fantastic, nice work. This sounds like sort of a little bit of okay, I need to be able to sort of own up and say sorry, and it's a quality that actually can be a little bit difficult for parents, especially parents in crisis, in terms of being able to take responsibility and make a repair for whatever the sort of mistake was, and try not to do it again. It's a really it can be a difficult thing, even though the act of actually apologizing doesn't seem all that complicated, but very substantial in terms of impact for not just parenting, but also for anxiety and depression states in kids. Another piece, well, let's sort of roll our memories back to Psych 101 and all of those great behavioral principles. These are I think components that parents sort of get early on, especially with younger kids. It can be not a overly complicated behavioral system that they set up, but it's the parents I think just intuitively sort of find different ways or read different strategies in terms of using these. And as kids and problems get older and more complex, sometimes these kind of go a little bit out the window. So just in terms of kind of a quick review, again, we like to think about positive reinforcement, working, and this is something that parents, again, when kids are young, their kids eat their vegetables, they get dessert, they pee in the potty, they get a sticker. You get enough stickers, you get a toy. As kids get older, sometimes there's chores or cleaning your room that can kind of elicit an allowance. And we all sort of operate under the positive reinforcement in our daily lives, our jobs. Is the way that we often think about reinforcement and sort of incentivizing a behavior that we want to see in ourselves or in others. Secondly, negative reinforcement works, and this is probably one of the most kind of misused and sometimes confusing topics, I think, is because often negative reinforcement can be used interchangeably, almost in the same way that punishment is. But we really want parents to think and accurately, it is literally just removing something that's unpleasant from another person's sort of awareness, or and the idea is that by removing that unpleasant thing, behavior that we want continues, or behavior that we want to change changes. And we all have this in our lives. We jump in the car, we drive down the street. 65 yards down the street, we get that annoying ding, ding, ding that our seatbelt isn't on, and then we click our seatbelt unless you're incredibly tolerant to that kind of a noise. So that's negative reinforcement, right? When we actually change our behavior from not wearing our seatbelt to wearing our seatbelt, the dinging goes away. And we can kind of replace, for parents, sometimes that dinging can be the annoying noise that masquerades as parent nagging or parent reminders and things like that. So when we see, when parents see those, the changes, or the kind of the behaviors that they want, we have to remind them that we have to make sure that we're not continually giving their kids that ding, 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 or the nagging, to make sure that again, that behavior change persists. Punishment. This is, something, and again, and very understandably, in a moment of crisis, parents can get a little punishment heavy, especially when they feel a little bit helpless and hopeless around how things are going, or are going to go. Punishment can work in a really specific, time-limited way. It's rarely effective over long periods of time, and it's actually a poor teacher of behavior change. When it's used as a primary motivator, kids, particularly adolescents, young adults, over a long period of time, will actually spend more time figuring out how not to get caught, or sort of not to get punished, more so than actually making really viable behavior change. So we need to try and get parents out of that punishment loop sometimes that they find themselves in. Behavior change is hard, and that's why we see extinction bursts. And when we're making changes, or we're asking for behavior change, we really need to make sure that it's really behaviorally specific. And that we're asking for what we want. And the hard part is a parent, has been responding to, or sort of providing behavior A, and then they change their behavior in an effort to create the behavior change they want to see in their kiddo. To behavior B, their kiddo is going to do anything and everything they can to bring back the parent that they knew and loved, that was sort of behavior A parent. And we see that, there's a lot of the behaviors that we're actually trying to get rid of can actually escalate when we're making those behavior changes. So we really need to be able to support parents to sort of be able to kind of like hold steady, be really consistent, know that those annoying behaviors are going to sort of peak and then start to level out, as long as parents can be consistent in terms of, their parent B behavior. One thing that happens a lot with parents is, they sort of intermittently reinforce the the very behavior that they don't want to see. And there's really not a more powerful behavior schedule or behavior change schedule that we can provide. And then what we're really teaching kids is if I really go for broke, if I really try and do the very behavior that my parents aren't willing to see, then they'll change their behavior instead of me changing mine. So really important concept for parents to understand, as well as finally that parents need to reinforce getting closer to the goal or approximations closer to the goal. Really, this is, again, can be a really difficult concept for parents because, if you have a kiddo that never does their homework and they get 5 nights of homework a week, and then, we set up contingencies where, we see, the kiddos getting 2 nights of homework completed instead of 0. A parent has a choice. They can either be really celebratory and happy about the 2 nights, or they can say, well, what about the other 3 nights that you haven't done? And which one's going to be, sort of elicit or continue that behavior change? So we really need to help parents really pay attention to when they see that behavior change, to sort of roll out the confetti cannon and make sure that they're reinforcing that instead of harping on the behavior change that hasn't happened, because 2 out of 5 nights is moving in the right direction and be much more likely to continue that change if we actually pay attention more to that than the behavior that hasn't quite changed yet. So we bring that up specifically because if parents don't understand principles of behaviorism, contingency management is going to be really, really difficult to do. Contingency management is it's a skill really, and it's something that isn't necessarily taught or kind of found in parenting in some sort of a parenting pamphlet. And we really teach this because we really want parents to understand that if they can set and establish and carry through effective contingency, that's what's really going to make help behavior change and build the capabilities that parents typically are going to want to see out of their adolescent or young adult, especially when some of those adolescent behaviors that we like to see with autonomy and responsibility sort of aren't exactly where we might want to see them developmentally. This doesn't necessarily tell parents, what contingencies to set or which ones are the right ones. Obviously, we wouldn't know that without stepping foot in the family's home, but it almost serves as a proof. So we want to say, if your contingency sort of meets these 6 principles, it's probably going to be fairly effective. At its bedrock and at its foundation, consistency probably the most important thing. I think at the foundation of contingency management, we really want to make sure that parents can set contingencies where they can reinforce that contingency in the most consistent way, not vary back and forth, and really hold to it. And ensure that their behavior doesn't necessarily change based on their kids' behavior or based on sort of emotional decisions in their behaviors. So if parents can be consistent generally in that contingency, it's going to be pretty effective. Livable. This is one of the hardest pieces in advance to kind of think about for parents, and really, really important. I've a 17-year-old daughter, and if I am, she drives, and if I want to make sure that she can drive her younger sister to softball practice, and there's a contingency that she loses the car if she doesn't return it with the same amount of gas as she took the car, and then she comes back, the car's on empty, she didn't do her job, and I say, oh, no more car for you, no more driving. Suddenly my contingency isn't very livable for me, right? Like, I'm going to be, resentful, obviously, that, she didn't, I've got to go put gas in the car, but also because now she's not able to drive her younger sister, which might mean, my life becomes a little bit less livable. I might have to leave work early to drive her younger sister to softball or whatever. So we want to make sure that all of our contingencies are livable by the very people that are really asked to establish and reinforce those contingencies. Intuitive. This is where we want to make sure that the crime and the reward sort of fit the punishment and the good behavior. We want to make sure that it generally flows in something that makes sense. Often parents find really powerful reinforcers, freedom, cell phones, boyfriends, girlfriends, things like that, and link every single sort of contingency to one of those 3 or 4 powerful things. And the hard piece is if I have 50 contingencies that all line up to my kiddo being able to use their cell phone. Once they lose their cell phone because they weren't able to kind of do whatever it was that the contingency called for, I now have 49 useless contingencies. And as we all know, there's nothing more scary than an adolescent with nothing to lose. So we want to make sure that it sort of our contingencies follow. There's some sort of like natural link to what we're asking for and what the reward or the consequence might be. And we want to make sure that it sort of fits both in terms of the, not just the sort of what that reward might be, but also that the impact of it, that it's not too great or too small, so we can kind of keep kids, understanding, why they're doing the contingency and the reward lines up with that. Collaborative, we really want to make sure everybody that's involved with this contingency is on board and knows about it. So this is all parents and caregivers. This is the kiddo themselves. And we want to make sure that that all of our contingencies are, again, really specific and everybody is on board. Often we see, sometimes we'll see, mom feels really strongly about something, dad doesn't feel so strongly, and that adolescent makes a beeline for dad, sort of the path of least resistance, in terms of not wanting to change that behavior to whatever the contingency is calling for. So we want to make sure everybody's really, really on board. Holistic allows, and a lot of collateral treaters, schools, other people to sort of be involved. And we want to make sure that they're just aware that we're sort of trying for behavior change, particularly therapists and other clinical providers. It gives them a chance to kind of check in, not that they're necessarily in charge of providing the reinforcements or feedback, but it sort of gives another voice to sort of checking in around that contingency management. And then sort of closing out on the other side of consistent being one of the foundational tools. Having an established plan is really, really integral as well. This is how sort of all rules kind of work in our society, right? You drive 95 miles an hour down the highway. It's not like you get pulled over and nobody knows what to do. We know exactly what to expect. The nice piece, I think, with parenting and contingencies and having an established plan is that all of the work is done ahead of things working or not working. It's done very much rooted in logic versus emotion. If there's an 11 o'clock curfew and somebody, strolls into the house at 11:30, we don't need to sort of come up with a plan or come up with a punishment. Everybody knows, parents know, caregivers know, and most importantly, the adolescent knows themselves because the plan's already established. It's not something we necessarily have to set it and forget it. If we, kind of figure out we need to, as we, should every, few weeks check in and kind of, see what's working, what's not effective, change the plan, and then again, keep that plan as established so everybody knows the expectations for the contingencies.
All right. So, so to sort of keep bringing all these things together. So in supporting families that have kids that self-injure and are suicidal, right? We want to help them identify if they're traumatized. We want to teach them behaviorism so they understand why behaviors happen and what makes them persist and how they can help their adolescent change those behaviors. We teach them how to set contingencies, and we use this wonderful model from DBT around what we call common parenting dialectical dilemmas. This is part of the middle path skills in the adolescent DBT manual. And what these are common dilemmas that parents who have kids that self-injure, engage in suicidal behavior, have big emotion dysregulation, parents find themselves polarized. And our task is to give them a tool to understand these sort of extreme positions that they may be taking, have compassion for themselves, and if they're co-parenting, have compassion for one another in trying to find a synthesis as they parent through these types of dilemmas. Okay, so the way that we use this is we want people to think about, like, where am I on one of these dialectics? How do I get driven to the poles? I'll give you a clue. It's often fear, right? This is the emotion that pushes us. What makes sense about the position that I'm in? Where's some validation, which we're going to talk to you about? How do I respect, if I'm co-parenting, the other person's position? Because often marriages suffer when children struggle in these ways because emotions run high and parenting is so hard. Where am I most and least effective? And how how do I get myself into a more synthesized position? So I'm going to briefly go through these. So the first one we have is normalizing pathological behavior and pathologizing normative behavior. Okay, this is a challenge in general, but are there ways in which we have we're normalizing behaviors that are really problematic? Like we often, this is where the new normal is, right? So we sort of reset a norm when actually the behavior is very problematic, but we get accustomed to it, right? Or the place where we're walking on eggshells because we're afraid to intervene. So we convince ourselves that this is, that it's normal. It's okay that I don't set any limits with my child anymore, right? Or it's okay that I won't talk to them about these kinds of things because if I do, they'll explode, right? So we have people pay attention, like, are we normalizing things that aren't normal? We've just become accustomed to it. All the way on the other side is, are we pathologizing things that are actually normative, often unpleasant or challenging adolescent behaviors? Now, where this dialectic becomes the most important to think about is often in for these kids, very normal adolescent behavior, tough days at school, not doing well on an exam that they had hoped to do well on, getting broken up by a boyfriend, these are a girlfriend. These are all very normative things that make adolescents upset. Now, when adolescents pair that upsetness with suicidal behavior or self-injury, those two things become merged, and parents need a lot of support, right? Every time the child gets upset, we don't need to pathologize that. Adolescents come home and they slam their door and we don't see them for a couple hours and they listen to music in their room, right? If in the past, while doing that, they have hurt themselves, right? Or done something dangerous or not come out of their room for 3 days, right? Parents need support in not pathologizing that, but being able to see that that's actually a normative behavior and that now that they've learned skills, we're going to give them an opportunity to learn. So parents need a lot of support around this dialectic. It's also, again, it's hard for, many of us had adolescents that didn't include social media and cell phones and a lot of this technology. So, what we think is a normative experience, may not be for them anymore. Okay. So the next dialectic that we will tackle, Jim's going to put it up there, will be fostering dependency and forcing autonomy. Okay. This is another place where parents get very polarized. In every parenting dyad, there tends to be one parent that's, going to be more comfortable sort of pushing a kid towards independence and one that may be more anxious about it. When you have kids that have deficits, parents can often inadvertently foster dependence, meaning that because the child has some deficits, we fill in the blank. And in doing that, we reduce distress, right? So it's anxiety provoking to organize your backpack, and you get very stressed out, and I get very stressed out. And so I organize your backpack for you, and you feel better, and I feel better as the parent. Again, this is working on negative reinforcement, providing relief. Okay. So what happens is the normative path is that we do things for kids when they're very young, then we do it with them so that they learn the skill, and then they sort of push us away and they do it on their own. Okay. When we get caught fostering dependence, that cycle doesn't move forward. Okay. And parents end up, when you're 18, still organizing the backpack. Okay. And so again, we need to help parents, right, shift. Now, what they can do is they can fly over to the other side, and that's forcing autonomy, right, which is pushing kids to do things independently before they have the skill set to do that. And this is often pushed by peers. It can also be challenging when some child's chronological age and their developmental age or skill set doesn't match. Okay. So this can be one that parents can ping back and forth and get very, very stuck, and also get very burned out and resentful of their child. So we need to help parents identify this and then work to navigate each of these different areas where they may have inadvertently fostered dependence or forced too much autonomy, and have a slower, more synthesized approach to help the kids learn the skills. And then the last dialectical dilemma is this authoritarian control or excessive leniency. This is highly, highly driven by fear. On one end of the authoritarian control is when we clamp down and we try to control the uncontrollable, right? We need to make them stop self-injuring. We need to make them go to school, right? We do all those things that don't work. We take everything away. And again, an adolescent with nothing to lose is a dangerous adolescent to have, okay? But the idea is all the way at the polls, we end up trying to control the uncontrollable. When that doesn't work, we often swing to the other side, throw up our hands, and say, I give up, right? And DBT would call that willfulness, and we become much more lenient. And so, you know, that doesn't work, and then people swing back and forth, and you get this swinging back and forth, and we need to slow down, right? And this is where we teach behaviorism, and this is where cliche and contingency management begins. And again, there will be times in which parents need to make the decision to be more lenient, and other times in situations where they need to be more authoritarian. But when caught and driven by fear, that ability to discern disappears, right? So we need to support parents in helping them regain that skill set. All right, this is we're going to this one, right, Joe? Yep. Okay. We're going to validation. Okay. So if you get the slide deck, there's a nice set of slides about sympathy and empathy, which is great. Validation is one of the most important skills that we teach. There's lots of webinars out there on validation. Validation lives in DBT in our relationship effectiveness skill. This is the skill that helps improve communication, connection, and feelings of understanding between everybody, but we particularly teach it for parents and their kids. And what validation is it's simply recognizing, right, that the other person's emotional experience makes sense given who they are. Validation has nothing to do with agreement or endorsement of behavior. We often may disagree. It has to do with letting that other person know that we're curious about their experience, that it makes sense given who they are, that we want to know more. Right. And validation actually functions as a way to help people regulate when we self-validate, which we also teach the kids to do. It helps emotions come down, thinking go back online, and often after validation, collaborative problem solving becomes much, much more effective. So we have a little 3-minute video, which we love, which is a little bit of a parody, but it's an extreme illustration of what we are hoping people do with validation.
It's just, there's all this pressure, And sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I'll bet if we got that out of there...
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing...
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail
See, you're
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just... Sometimes it's like there's this achy... I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. All of them.
Yeah, that sounds really hard.
It is. Thank you. Ow!
Oh, come on. Ow. If you would just...
Don't...
Try to see things my way. Do I have to keep on talking till I can't go on? We can work it out. We can work it out.
All right. So validation is probably one of those most important skills that we teach parents when we sort of put things all together. Now, The key to remember is that kids that struggle with self-injury and suicidal behaviors are often exquisitely sensitive. The dose of validation that they need is higher than the average person, right? And so you may have one child that doesn't need that much validation. You say, take the nail out. You have other more exquisitely sensitive kids that before you offer the problem solving, you have to offer the validation. Okay. So these are just some quick points around validation. We could spend an hour on validation, right? When we validate, we deeply listen to the person. Okay. We don't lead them. We want to understand what their experience is. We want to work to see the wisdom in their position in the same way we do with those dialectical dilemmas. We want to search for what makes sense about how they feel. Okay. When we want to do things like set limits or problem solve, we do use words like at the same time and, right? I recognize that this was a really painful breakup. And at the same time, right, you need to get up and go to school. You need to help around the house, right? That both of these things are true. Okay. We are generating compassion and empathy for how someone feels, even if we disagree, even if we think it's more intense than it ought to be. Okay. And we recognize that the other person is an expert. So if we lean in and get curious about somebody's experience and get it wrong, we let them tell us that we've got it wrong. We agree and we get more curious. Okay. When we invalidate, what we're trying to move away from is we're judgmental or we assign intention to somebody's behaviors without being curious, or we give advice, right? So moving immediately to problem solving for a sensitive person and giving advice is invalidating. It sends the message like, oh, this is an easy problem to solve, right, for them, even though it may not be, right? They need more of that validation, right? Invalidating words like exactly what you saw in the video, like if you would just, or you should do this, or just do this, right? Are often statements that are going to be followed by a way that's going to let the other person know that their experience wasn't so valid, right? We try not to treat people as fragile, right? We are compassionate and direct with them, right? Or that we, move into validating the invalid, right? So it's not agreeing with something that's not true. It's looking for how to make sense of how they feel, okay? So we're looking at, supporting parents and helping them understand their own experiences, and if they're traumatized, what that means, and give them some education. We're teaching them about behaviorism. We're helping them think more dialectically and helping them understand ways in which they may get polarized, right, or extreme in their responses. We're teaching behaviorism and contingency management, and we're helping them learn to validate both themselves and their exquisitely sensitive child. Okay. And fundamentally, parents who have children that have struggled with suicide and self-injury need support, right? When you support parents, when you educate parents, when you give them a community of other parents who are struggling like them, they do better. Actually, their kids do better when you skill parents up, and their marriages tend to do better.
And I think that fourth bullet point is a great call out. Just for when parents receive support, the implicit relationship between parents and kids is better, and kids are actually more adherent to treatment when parents are part of the treatment. We kind of get out of that identified patient model, and we see better outcomes in treatment when parents are involved and skilled up and supported. So there's virtually no downside, and the fact that we can actually positively impact kids' treatment by supporting and skilling up parents is pretty integral. There's a couple pages of references that will come out with the slides as well, if you wanted to grab any of the references that sort of helped build the slide deck out. And then a resource page for clinicians as well as families with some contact information at the bottom.
Brilliant. Thank you so much. We have one question from the audience asking, how can we foster resilience within family systems to support adolescents coping with self-injury?
You want me to take this one, Jim?
Sure, go ahead, John.
We teach them skills. I think parents, kids will be more resilient, I think, also if we can help support parents. Parenting is hard. Parenting and under the best circumstances now is hard. There are way more demands on kids. There's social media, which is a whole nother sort of dimension for those of us that are parenting now that didn't grow up with social media. If we can skill up and support parents, and we often go to schools and do general skills training for parents on things like validation, behaviorism. Like if your kid is doing this, what's reinforcing it? How might you be inadvertently reinforcing it? And what can you do to help them develop new behaviors? Help parents understand, like, what are the warning signs? What should I look out for? And fundamentally, how do you get your teen or your middle school kid when life is getting hard to talk to you, right? What are the skills that you have as a parent to help kids feel like they can talk to you, and how do we respond to them in a way that keeps them talking, even when what they're sharing with us might be very hard?
Great points, Jillian. I think the other piece is often when there's overlap when we think about a lot of skills that we use out of DBT. There's a lot of overlap in terms of skills that are being taught to parents and to kids. And again, I think for parents to be able to recognize when kids are sort of maybe not getting it perfect, but really leveraging some skill usage, and for maybe even more important or integral in terms of the relationship, when kids can recognize when their parents are actually practicing some good effective skill usage, and that really inherently is going to continue to build that communication, and that's the one piece I think is going back to the question around self-injury. As scary as it is for families to know that their kiddo has or is self-injuring, to not know that it's happening or not have communication, then that is probably tenfold scarier. So we really want to make sure that open dialogue is there, and often teaching skills and having that shared skill set can help foster that.
Wonderful, thank you. We have another question that asks, how long can these symptoms of secondary trauma last for after a traumatic incident?
Yeah, it's a. You want me to take it, Jillian?
Sure, and I'll follow up if.
Yeah, I mean it's a great question, and I think the longer somebody sort of suffers in sort of by themselves, typically the longer those symptoms are going to last. I don't there's not necessarily a time frame. I think that where something starts, there's the middle and then it ends. But I think that the more, and when we talked about that sort of that arrow, and kind of the factors that kind of potentially predispose folks to moving toward PTSD, I think that the biggest thing is that first support where people aren't suffering by themselves. They're not, they have sort of another a voice or an audience. Often, we really, in addition to providing skills and support groups for parents, that obviously teach a lot of these skills. I think one of the most important things is for parents to be able to feel like there are other parents and families that are going through similar scenarios with their kiddos, because those aren't the things that that show up on Facebook or that go into family letters or whatever. They're often suffering in silence and solitude, and to be able to know that there are families out there and that they can say, I know what you're going through. I was there 3 months ago. This is some of the stuff that I did that wasn't that effective, and here are the things that really helped me feel better and do better in terms of skill usage and with my kids.
Yeah, and I think one of the things to remember that I think many people and certainly many providers forget about these parents is that many of them are experiencing this over and over and over again with no end date, right? So there's treatment and PTSD that happens when you have a single episode of trauma. And there's another level of this kind of trauma where it can go on for years, never quite knowing, are they going to self-injure again? And are they going to make another attempt, right? Because they never have that assurance. So again, many of these parents will have these symptoms for a long time and actually will, do well with PTSD treatment.
Brilliant, thank you. We have a different question that asks, how do you address social media when working with parents and adolescents?
I mean, such a hard question. I think how you respond with social media is also going to depend on the age of the adolescent, right? So what a parent may do around social media at age 10 is very, very different than what they might do at age 16, or, as they approach going to college. The younger the kids are, the more parameters I often work with parents to put on their social media, because they can put those on their social media. The older the adolescent gets, certainly you can have those parameters, but the shift has to be around teaching the kids how to manage social media, right? How to be mindful of, is checking your social media X number of times a day helpful for your mood? Is going to bed with, your phone right next to you, effective? Like, how does being on or off social media impact your mood and your relationships, right? Because as I always tell parents, our goal with social media and managing screens and video games and phones and all of that stuff is we've got adolescents and high school to teach them the skills to manage, because once they go off to college or they go live independently and get a job, we've missed our opportunity, right? And they will, be sort of out there having to manage this on their own. So I tend to take an approach of, more restrictions when they're younger, and then lifting the restrictions and adding the skills to teach them to really pay attention to the way social media and screens impacts their moods and behaviors, and how that is linked in an effective or ineffective way to their long-term goals and independence and all the things that they, want in their life.
Thank you. I think we have time for just one more question before we wrap up. And one asks, how do you cater to denial and guilt that the parents might be experiencing?
Yeah, it's a fantastic question. We see tons of parents that, guilt and shame are sort of, really ever present emotions, for them. I think that compassion toward ourselves as parents, and teaching parents that they need to be able to be compassionate toward themselves. So I think one of the hardest things for parents, particularly parents that have an emotionally sensitive kiddo and then a second kiddo or a third kiddo that is not particularly emotionally sensitive, is that, they can feel incredibly effective with one kiddo that didn't have sort of the needs and the kind of prerequisite validation that sometimes happens or needs to happen with emotionally sensitive kids. And that they can feel really ineffective. They can feel like suddenly, I felt like I did a really good job with, kiddo A and not so much with kiddo B, or I feel really lost. And, that guilt and shame, I think often, being able to kind of lean into it with parents, to talk about it with parents. Again, a huge fan of sort of those conversations that can happen with other parents that are struggling in similar ways. I think often is able to kind of reduce some of that guilt and shame around what they're parenting, what they feel like are enormous deficits, that it's really, really hard, and kids don't come out with sticky notes that say I'm emotionally sensitive and I have a different set of needs than maybe a different kiddo is. So it makes sense, and I think often that suffering in silence or suffering by themselves is probably the thing that really can ratchet up the guilt and shame in a way that we can really provide support and compassion and teach parents to be compassionate toward themselves.
And I think that wraps up our questions from the audience. Thank you so much.
And thank you so much.
Thank you for joining us, Dr. Galen and Jim Holsomback. And thank you to all of our listeners for your participation. We'd also like to thank McLean Hospital for making this webinar possible. A recording of this presentation will be emailed to everyone in 2 weeks' time. The recording will include the presentation slides. As soon as the webinar has ended, a short survey will appear on your screen. Please take the survey and give us your feedback. We thank you for your attention and hope you have a great day.